Welcome to Pediatrics for Parents, a podcast for parents and caregivers of children. I'm Dr. Jeffrey Kyle, a practicing pediatrician at PAC Pediatrics in Kingston, Pennsylvania.
And I'm Dr. Alvaro Raimunde, also from PAC Pediatrics in Kingston, Pennsylvania, also a practicing pediatrician in the area. And I want to thank you guys for joining us on our podcast today. It's going to be a fun topic. We have a special guest. We'll introduce her shortly. And a little bit about this podcast. It's one that we've been releasing now for a couple of months. And basically what we do is we take trending topics or topics that we hear a lot in the office and may need a little bit more clarification, or maybe you've heard something in the news. We try to take those topics and digest it for you guys, and we talk about it in an easy to understand fashion. So
that's right. So today our topic is it's episode number 5, and our topic is feeding children, infants all the way up through toddlerhood. So we're going to talk a little bit today about, the proper time to introduce foods, how to do it, how to work on it, and what to do when you get into some problems with choking or picky eaters and things like that. So, and today we've brought a special guest with us, Karen Kyle, who shares my same last name because she's my wife. And we are going to, she's actually a pediatric occupational therapist and works a lot with children with feeding. And that's one of the main things that they do. A lot of times with occupational therapy, you think about people using their hands and things like that. It's very an adult-centric
after an injury,
or something.
But
in children, they do a lot of therapy for them with their feeding. So she's an expert that deals with that. So I would really like to welcome her today.
Yeah, we're excited to have you.
Thank you.
And so, like Dr. Kyle just said, we're going to be talking about maybe some food introduction, maybe what's the best way to go about it, what age, what type of foods we start with, and maybe some common questions that we get in the office and things like that.
Right, exactly, because we hear about this all the time.
Day
it's
in, day out.
About feeding, and hopefully we could make this very informative. So let's dive right in. So let's talk, a lot of times around the 4-month-old visit, we start to get questions, and actually like to do some anticipatory guidance with parents about food introduction. So how do we approach it? What do I do? Do I give purees? Do I give chunkier foods? Do I give cereals first, or fruits, vegetables? Do I have to follow a certain regimen?
Are there rules? And
right,
you hear start at 4 months, you hear start at 6 months, and like you said, cereals. And then if you remember our previous episode about heavy metals and cereals,
right.
We talked about that earlier, but basically it is safe to use cereals and things like that.
Correct.
But let's just jump in. So I typically in practice will start, like you said, around the 4-month age to start talking about introduction to first foods.
Right.
But it really depends on how developmentally ready the baby is. So
100%.
What are some things that we can look for in a child?
In terms of a child being ready to go from nursing into more solid foods, one thing you can look for is how are they developing? Do they have good neck control? Do they have good head control? Can you prop them up comfortably into a high chair or a seat, because you want to make sure that the food is going to go down safely and effectively.
Right. And that's why the American Academy of Pediatrics, they recommend really starting solid complementary foods into the diet between 4 to 6 months. So there's a broad range with that, and I think a lot of it has to do with, is your kid developmentally ready? Because there might be some 4-month-olds that can't really sit head supported yet. It might take a couple more weeks.
Yeah.
So, you have to sort of look at it that way.
Yeah, and the other thing is the baby's interest. I have babies that at 4 months old, they're all four, they're reaching for foods, and they seem really interested. You approach with a spoon and they open their mouths. Whereas I have other kiddos that are closer to 6 months, 7 months, and they couldn't care less about foods. And should those parents be pushing the child to eat? Does it mean that they're a bad parent because their child isn't eating? No, right? It just depends per kid.
All of their nutritional value, nutrition will come from their breastfeeding or their formula feeding, depending on what the parent wants to do, because the foods are complementary in addition to that milk that they're getting. And I think another key is that we really don't want to give any complementary foods, ideally, before 4 months of age, because studies have shown that there's an increased incidence of having children that are overweight, and if they're fed complementary foods too early, and concern really about being able to digest it, because their pancreases are still fairly immature if you're
Right.
going less than 4 months of age. So there's some
Absolutely.
other physiologic reasons why you might want to stay away
Yeah.
from
And-
starting earlier.
And going back to what Karen was saying with the being developmentally ready, most kids 4 months and younger don't have that neck control to kind of keep it propped up. You don't want to be feeding your baby and have his head be all like wobbly.
I know, yeah, like they're at a Metallica concert,
Right.
like bobbing their head up and down.
So, all right. So let's say a child seems to be holding their head up pretty good, and they seem to be interested in starting some foods. How do I know what foods to feed our baby? Like, what would
Right.
those first foods kind of be? Is it more what types of food? Is it more like texture based?
I think what you'd be looking for would be texture based. So as a baby develops, they're going to go from that nursing, whether it be breast or bottle, where their tongue is up really high and they just have to get the liquid down, to being able to have a tongue more like a child, where they have to move it around and eat. So you want to have a gradual progression. So what you really want to start with would be more of those thin purees, the baby cereals, things that are almost like what they're having with their formula or their
Right.
breast milk. So that's a good starting block.
Yeah, because they have to overcome that tongue thrusting, and it's
Yeah.
normal for babies to spit their foods out in the beginning, because they have to overcome that sort of neonatal reflex of tongue
Thrusting,
thrust
yep.
and actually swallowing. So that's
Right.
a learned behavior.
So that brings me to another question that I also get is I have parents that tell me, oh, my kid doesn't like food because they keep pushing it out with their tongue. Does it mean they don't like the taste of the food?
Typically, it wouldn't have so much to do with the taste. You could notice if a taste is new and novel, and they might grimace or move their head back, and it might be something that they just were surprised and unprepared for. But in the same sense, when we're looking at how the child has gotten their nutrition up to this point, it's been this nice coordinated back and forth movement of their tongue, and now we're looking to change that a little bit. And so some things that a parent can do is, if they're pressing with the spoon just a little bit to help the tongue along, that can really help for them
Like
to
pressing
swallow.
the tongue down,
Just
you
a
mean?
little bit, yes. To put a little pressure on the tongue and help move it out of their mouth can help them.
That's
Oh,
a good
yeah,
tip.
that's a great
And
tip.
I forgot to mention, we're going to be talking, and this conversation is surrounding, developmentally normal children. We're not really going to be talking about kids with special needs or facial malformations like cleft
Correct.
palates or any bifid uvulas or anything like that. We're talking about, the average baby that just comes into your office. So,
And then the other thing is with foods. I know when I first started practicing, and I always feel like whenever I'm always talking about dating myself here, but when I first started practicing,
all the bottles were glass.
yes, they were glass. But we with the purees, we went by okay,
Yes.
you have to start with your greens, or don't give fruits before vegetables because the babies will get a taste preference for the sweet. Does that really mean anything?
Yeah, I mean, what do you think?
I would say in a typically developing situation, it would probably just have a minimal difference. That if you fed your child fruits first, odds are that they will transition to vegetables. But there are those situations where a child may be a little bit more picky, may have a difficult time with textures, or start to develop those preferences. So by having the vegetables first, it may give that little advantage for some kids who might need that.
Yeah.
But overall, I think to start with the fruit wouldn't be necessarily detrimental.
Yeah, I mean, I think one thing we've realized through the years is that, in a world society, different countries and cultures do things so differently all the time. So, in India, they might be starting with certain ethnic foods that they like, or in Europe, be doing certain ethnic foods. And so really there's no wrong way here. And
Absolutely.
I don't know how you do it, Alvaro, but I basically counsel my parents, hey, just as long as you're introducing only one new food every 3 to 5 days, because you're looking to make sure there's no allergies, that really, keeping with some sort of regimented structure is pressure, and it doesn't really
And
help.
I agree 100% with that. When I counsel my patients, I say the exact same thing. And And one of the other things is that, especially, this is dating the episode a little bit, but, we're just coming out of the COVID pandemic, kind of. And there's a lot of food insecurity. And, maybe some families don't have fresh produce, or they can't get, the baby food veggies or the baby food fruits or the actual fruits and veggies. And they're not just going to not feed their kid, right? You're going to feed them what's available. But what's important is that texture, right? Make sure we thin it down to the point where it's appropriate for that child.
Sure. And there's also, now it's becoming more popular in the United States, and it's been, I think, more popular in Europe. I think it was specifically in England. There's been studies done on baby-led weaning, and I get a lot of questions about that. And that's, for those of you unfamiliar, it's really giving babies almost like chunks of food or table food, and just surpassing giving purees, where they actually finger the food themselves and feed it to themselves, and that's their introduction to foods instead of doing purees. And any thoughts on that at all as a method of feeding? I know that it's been becoming much more popular. I don't know if you've run into any people that have been doing that in your practice.
Well, what we find, especially as a baby would start to get a little bit older, into childhood, is that ability to take control over your own self-feeding can be very important, because then you feel like you can moderate. How much do you want? Do you like this? Do you not? The pressure's not there that somebody's shoving something into your mouth. However, with that, there's also areas of making sure that they're safe and developmentally ready. One thing that we found is that often it may be difficult for children to go from the purees and jump into more complex foods, but by giving them things that they can move around their mouth and get their mouth ready for more complex eating can be very helpful. So, for example, if you were to give them, say, a carrot stick or celery stick, something they can't bite off, but that they can roll around their mouth, it will help them, it will make their tongue in a better position, and it will get them ready for that. So I think that, with anything else, there's merit to developmentally, letting them self-wean, but then there's also giving them things like that to give them the tools to be ready for that.
And I think if you're going to approach that baby-led weaning, I think it's a valid approach. If people want to do purees, that's fine, or baby-led, but you always want to make sure that the texture of the food, if they're going to be putting in their mouth, is something soft and mashable, and something they can easily put in their mouth that's not too hard.
Absolutely,
right?
yeah.
Right.
Yeah,
I'm sorry.
No, go ahead.
The things such as like the biter biscuits, like the cookies, things that they can kind of really eat, and it'll just kind of melt off of there. So then it becomes more like a puree, and they can swallow it. Is a good way to start with that. You want things that they wouldn't need teeth for. They wouldn't have to really move it around their mouth to get it to a swallowing point.
Yeah. And really, there's some inference that what you were saying to Karen about the fact that I want to underscore the fact that babies can, with the baby-led weaning, maybe can self-regulate themselves better because, they know when they're done and full. Whereas, if you're puree feeding, sometimes the parent will be like, I could give you 2 more bites. Let's clean this up, when really they're full. So, it may help with that. It may help them transition to just being on textured foods and understand more foods better. So I don't know how you feel about it, but...
Yeah, I'm on the fence. It really depends on how you approach the baby-led feeding. Like Karen was saying, I would definitely want to make sure that the kid is developmentally appropriate for that food. I'd worry about the choking hazard.
Yeah,
absolutely.
I'm okay if we're sure that it's a piece of food that the baby can't chomp off. If they want to grab it and smell it and lick it and kind of explore the textures of the actual food, but not be a real choking hazard, like maybe a raw banana. Sorry, not a raw banana, a raw carrot, where a baby won't be able to take a bite off. But if they want to touch it and smell it and kind of like lick it or something, maybe that would be okay to start introducing. But I probably wouldn't give them, for example, a banana for them to hold on their own, especially a very not mature one, but when it's a little thicker, where they can take a bigger chunk that they can swallow, and that can cause a choking hazard.
Yeah, and I sort of tell parents with that with baby-led weaning, that they really have to educate themselves about to understand all the developmentally appropriate things. But ultimately, whether you choose to do purees or that method or many other methods, feeding your baby is sort of like religion, in that there's many different religions, but they all get you to the same place, heaven, right? So these different methods of feeding all get you to the same place of eating
Yeah.
solid foods.
Yeah, I agree. I don't think there's a particularly wrong way,
Yeah.
unless you're feeding the kid,
Yeah.
fast food every day for every meal.
So let's jump forward now to, if we're getting to the point where babies are like around 9 months, going into that year age, and it's really, if you've been doing pureed foods, you want to be beyond that and actually be eating textured foods when you're older like that. But I often get, the stumbling block, I think, for a lot of parents is when I talk to them about, at their 6-month visit now, about, okay, well, if you've been doing purees, we really have to start to transition to more textured foods, because I don't view, and Karen, you could correct me if I'm wrong here, but I don't view delaying that as a good thing, because it's not like bike riding, like, as the kid gets older, their coordination gets better so they could feed better. It seems like once they get past that year of age, if they're not eating more textured type foods, it's actually harder to get them to get past the puree.
Right. So you definitely want to take things in a sequence so that you're not taking them just from here's the puree to here's what's from the family table. You want to have this into a nice progression. So doing things such as we had talked about, doing something that's meltable in their mouth, like the biter biscuits, cookies, things like that, and then getting into like softer cubes, things that they can still mash with their tongues and effectively swallow. So for example, if you had a soup and you have like the little vegetables from the soup, something that they could easily mash, it's going to get through and they're going to be able to swallow it efficiently. So kind of moving in that kind of a progression.
So it's a good transition.
Right. And from there, things like muffins, things like that. But you want to get them into a transition with that.
Yeah.
So that they don't have to make a huge leap. What we tend to find is that the hardest thing to transition to would actually be something like a stage 3, where you're dealing with that lumpy, bumpy, all of these things are going on at once. Their mouth has to separate a liquid from a solid and all of this. That can be more tricky. Those are the things that you may want to delay till closer to a year, depending on your child. You may want to start with some of these other things that are just easily mashed up and swallowed.
Yeah, because even though it's harder, I mean, well, it's a singular texture, where those stage 3 foods, like you said, they're actually dual texture. It's probably harder.
Right.
Yeah. And then, the other thing I hear about is parents will be like, oh, Dr. Kyle, I've tried to give my kid more textured mashed foods, and he started choking. And I got really nervous and scared, and I'm afraid to actually try to advance the food because I don't think they're ready.
Yeah.
Choking, gag, there's a difference between what a choking is and a gag is. And is gagging normal when kids are learning, or should they all be able to just, give them the food, and if they're not swallowing it, hey, they're not ready?
Yeah, I like to remind parents that we all sometimes gag with when we, especially like me, when I'm really hungry, I just scarf it down. I'm like, oh!
Yeah.
But no, gagging, and this is why in the beginning of the conversation, I wanted to make sure that everybody understood that we're talking about developmentally average, appropriate children. Most children that have started food introduction have a strong gag reflex, and that's good. That means that they are able to clear their airway if maybe it went down the wrong pipe a little bit, or maybe they tried swallowing a food that was maybe too large. They have that gag reflex there to protect them, and as long as they have a good gag reflex, they're good and healthy, and it's perfectly fine. Just because they gag on a food does not mean that they're not ready. Right. Or that they're not ready for that food. Maybe the kid just got a little overzealous, like Dr. Raimunde.
Because choking is really food getting lodged in the throat where you have no air movement.
Yes, and
that's a dangerous situation to be in. Where gagging is just protection of your airway, and all. Again, going back to the bike analogy about it's like riding a bike. When you put your child on the bike for the first couple times, they're going to fall off.
Absolutely.
And when there's something new coming into the mouth, they're going to gag a little bit, but it's okay. I mean, do you ever hear that from parents about
absolutely, and I think it's a normal response as a parent to be very apprehensive about a child choking. That being said, when you're a baby, you're going to gag very easily. Anything that goes anywhere in your mouth is going to cause you to gag. As you get a little bit older, getting closer to a year, that's going to go back further and further in your mouth, so that you're not going to be gagging the second something hits your tongue. And you'll see that gradually progress. There are some things you can do if you are apprehensive or your child child seems like they're really gagging a lot, things like the little mesh pouches where you're putting in so they can bite on it, but you know that any solid remainders aren't going to go down. You can start with things like that. Also, actually, when you look at their mouth, if you make something a little colder, or you add a little extra flavor, such as cinnamon, maple syrup, something that your mouth becomes very aware of, it's easier to swallow. So that can also help if a child, say if they're gagging on applesauce, but then you put a little bit of cinnamon or something like that, it might be easier for them to swallow that effectively and fully.
Sure.
And for the parents that are wondering, well, how do I know if my kid is gagging versus choking? I always tell parents that if a child is actually choking, it would be very hard for them to actually produce a sound.
Yeah.
Because with a real choke, there's a full blockage of that airway, and that baby, you'll see that their face is red, but they won't be able to cry. They'll be mute. They'll be trying to, but they won't be able to.
Right.
So that's when your kid is choking, and that'd be a talk for a different conversation.
Sure.
But that's the difference. With gagging, you hear the and they're making a noise, and they could be very upset.
And then briefly, around 6 months, too, just taking a step back a little bit, it's okay to even start to introduce a sippy cup to kids because, again, children that are, and this is more for children that are bottle fed, we want to try to transition out of the bottle at least by a year of age and getting them introduced early to that. They may not know what to do with it, but again, it's trying to get them to at least become familiar, right?
Absolutely.
Okay. So let's move on to the, so we've got through infant and, transitioning to textured foods. And then, so if we move beyond a year of age, then we're talking about mealtime and actually having regular meals because at a year of age, pretty much, whether you're breastfeeding or formula feeding, the primary nutrition source now after a year of age becomes the food, just like it is for us as adults. And then really milk takes a secondary, back seat sort of, and we introduce whole milk at that point, So then it comes down to taste preferences and, feeding meals. And what's a good way, I think, to start, I guess, good habits to have when you're starting to feed food, because it then becomes more of like a family meal time, right? So what are some good habits really that we should be getting into from the get-go?
So I think some things is that you want to make eating a pleasant, positive experience whenever possible. And we do have times where it obviously becomes stressful or pressured if a child is really refusing and things like that. But the more that the child feels comfortable and able to eat on their own terms, the better they'll be. We want them to feel very relaxed. We want them nice and awake and alert when they're eating, not overtired. We don't want them super hungry when they come to the table, because we also don't want them over hungry where they're no longer hungry. So that kind of thing, like waiting hours and then feeding them when they're like ravenous, they're probably going to just hit that miserable phase where they're not hungry.
It's like having those kids that are overtired when it's time for bed. If they get past their tired phase, they become more rammy and hyperactive, actually harder to put to sleep. Sort of the same thing. If you're over hungry, they might not be too dysregulated to actually want to sit down at the meal.
Right.
Or distracted, right? Like
Exactly.
people who sit in front of the TV or have phones at the table.
Right. You want to make it definitely a sharing and an experience for the child, as compared to all of the pressure being on consuming exactly one thing. As they start to develop and you have this family meal, sometimes it could also be important that they can model what the parents are doing and that there's at least some food on the table that everyone is eating, so that it's not, well, mom and dad have this and I have this.
Exactly.
So being able to a certain extent, have foods that can be shared for everybody will help develop good eating habits.
Because children model behavior. I mean, just like, children learn at a very young age how to hold a TV remote and change the channel, or hold a phone up to their ear, or unlock a cell phone. It's the same thing. They're modeling. If they see the parents eating certain foods, they'll want to model that behavior.
Absolutely.
And I think keeping the table that you're sitting at very stress-free, bright, and inviting, I think is really important.
And having everybody eat the same meal. Like I always tell my families, I don't believe in kids' meals. Like Whenever we go out or anything like that, anytime I see children's menu and it's like hamburger and hot dog, which is fine to have once in a while, but there should be no children's menu. It should just be a regular menu, and maybe you can ask for a smaller portion.
Right.
I think Karen and I talk about that every time we go out to eat too. Like when our kids were younger, you see this, oh yeah, it's a hot dog, it's a hamburger. Well, why can't they eat the healthy food
Right.
that we're eating on a children's
Right.
Just a
menu?
smaller portion. Just charge a little bit
Absolutely.
less, maybe.
Absolutely.
But and then the same thing goes for the dinner table. I have a lot of parents that will just assume, oh, my child won't eat that, so I will make them something else. I'm like, well, did you ever ask the kid, or did you really offer it?
Yeah.
And did you explore it? So
Right.
there's a lot of that going on too.
I think children can learn too so much by watching the parents and the brothers and the sisters at the table, because what you'll see is that they're learning what the food is like. How is it going to be for me to eat this? How long will it take me to chew this? What is it like when someone else? So they will be really learning a lot by watching other people eat the foods. And so by giving them the same foods, they're learning a lot with that.
And any new introduction of anything, and the kids are going to be, when they're so young, they're going to be introduced to many new different types of foods, and it could take up to anywhere from 10 to 15 times of exposure to the food before that they know that they actually like it.
Absolutely.
And the exposure doesn't have to be that I'm putting it in my mouth. The exposure could be on the plate. It could be the parents even just talking about eating that food and what they're having for dinner to the child. So, or helping prepare the food. So it's just exposure over and over.
Yeah.
There's been studies. There's a Finnish study that I was done that looked at kindergarten kids and those kids in kindergarten classes where they were doing coloring, with certain foods and actually growing the food in their kindergarten and then maybe preparing the food in their kindergarten were more apt. Those kids are more apt to try new things and accept those foods. The control group
Yeah.
where they weren't doing that, they were more picky. So
And it makes
just
sense.
exposure over
Exactly.
and over again, right?
Right.
Yeah, and that's why it's so important to actually have a meal time with the child, with your young one. A lot of families will feed the child first, then put him away. Not put him away, but you know what I mean. Put him in a drawer. No, but we'll feed the child first, and then they'll sit down to eat because they can't handle feeding the child and then feeding themselves at the same
Right,
time.
right.
It should just be all together in one.
So, before we move on to like the 2-year-old picky eating thing, I think we've outlined a couple things here about, okay, now we're sitting down together, we're having family meal time, the space should be very inviting and should be stress-free and fun. But the one thing is, well, like what if, you have parents that have alternate diets? So, whether I'm on the keto diet or I'm a vegan. So, I want to give my kid a well-balanced diet, but yet I'm going to sit at the table and what do I do?
Right, and it is very challenging because there are so many diets and dietary needs of adults that may differ from what the child needs. One thing is looking a little bit outside of the box. Maybe dinner is a little bit more of a challenging time, but maybe breakfast is a food where everyone can have eggs or something like that. There could be a certain time or a certain type of meal that would work. I would also make sure that some of what you can eat is incorporated into a family meal so that if there is something, say, on a keto diet where you can have a certain type of food, that's part of the family meal. So maybe you don't have everything within the
Right.
courses there, but you at least can show that you are participating in some food that's a commonality to
Right,
the child.
So with 3 meals a day, when we talk about mealtime, we're not saying it has to be, we're not saying
Oh,
dinner. We're saying as long as it's a meal that you're sitting down, at least, right, try to get for one meal a
Right.
day at least.
Realistically, if one time, not even if it's every day, but ideally if you could have at least one time that you're all sitting down, even if it's only for 10 minutes, but
Yeah.
just to make that count, I think really can show a good progress in the child's development of eating.
Yeah.
Yeah.
So the next stage here is like once we get beyond that, we're trying to establish good eating routines, but then now we get to be 2 years old, and the next common thing, I'm sure you hear this a lot, is my kid won't eat. My child refuses to eat. Is that normal?
Oh my gosh.
Or should my kid's been eating well, and should they just be eating 3 meals a day, 2 snacks, and at 2 and be loving food?
No, 2-year-olds are a little bit of maniacs. They they don't slow down. A lot of them don't. I know certainly my twins did not. And they tend to try to be more grazers because they don't want to slow down. They don't want to stop doing what they're doing. They've developed these motor skills where they feel more comfortable running and exploring and climbing and all these things. And it's very hard for them sometimes to sit down for a meal. So if they can get away with grazing or eating a bite here and running away, and they're going to do it. They're going to do it. So I think it's very common. And this is the key age where kind of picky eating really starts to flourish. They really start developing these tastes and what favorites are and things like that. And I feel like without the proper tools, some parents can fall into that area where their child will start to become the dreaded picky eater.
And I think, I often tell parents that if your child is growing appropriately, when we see them for their well visits and they're on the growth curve and they're thriving, if they're not eating and they're being picky, it's okay. Because you don't want to get too overbearing and make it, go from what we were talking about, having a very welcoming table, to you have to eat this and why aren't you eating this, or putting food in the child's face, because then it becomes feeding can become stressful, right?
Yes, absolutely. And the more, if you think even as an adult, the more stressed you become, the less hungry you often would be in, say, a panic situation where you're just going to get upset and you're just going to turn it off. So you definitely want to keep it in more of a happy realm with that. And, trying to find foods that the child is able to easily eat while they're eating.
And also, I do have some parents, too, that differ in their definitions of what a picky eater is. So is a picky eater somebody that just doesn't eat a lot of food? Or is it a person that just has a few foods that they actually will accept?
So it varies. Really what we look for as far as picky eaters, where you can easily tweak things to where it becomes problematic, you're going to be looking for some different red flags. If a child can eat, say a 2-year-old is able to eat 20 different foods, then we're above, then we're pretty good. But if you start to see that child is less than 20 foods, and then this one they'll no longer eat, and then this one they'll no longer eat, then we're starting to see some red flags with that. Other things that we're looking for, and to address your earlier question, are they gaining and growing, obviously, but also how is their level of alertness during the day? Are they becoming irritable? Are they becoming too tired because they're not getting adequate nutrition? And is their gain an appropriate gain versus that they started with a good weight and their weight's okay, but it's actually dropped. Things like that I think are the bigger red flags.
I try to underscore to parents that it's our job to provide the food and give it to them, and then it's the toddler and above's job to accept it or not accept it, and so it's on their terms. So again, there's try to think of it that way to avoid the stress. So if they don't want it, you could put it away and bring it out again a little bit later. Sometimes maybe doctor it up a little bit, but I always try to think it's probably not a good idea to remove that food from the diet at all, right? I mean, what do you do if the kids are like, gosh, I don't want to eat this food? Like, do you still put it on the plate? Do you give it to them anymore or not?
So I think you would look at a range of how is the child reacting? Is the child pleasantly saying, I don't really want this? Or are we dealing with tantrums and like avoidance behaviors and a lot of moving away from the food where it's becoming a big problem? So certain foods might be just off the table because they're just too hard. But with other foods, you do want to reintroduce them. Sometimes also you want to do it in as comfortable as a means as possible, in a non-judgmental way. So for example, if they have a little table somewhere and say the child doesn't like strawberries, or this is what you're trying to achieve, is them eating the strawberries, cutting up a few, putting them on a thing and letting the child find them on their own, so that the child is trying it on their own. So if they like it, it's great. If they don't, but no one is going to then say, oh, you ate it, now you have to eat it again. So I think that bringing it back on the table can be fine, but also looking at their reaction. Are we really panicking if we put spinach on the plate where then the whole meal's done? If that's the case, you can do it at a different time as well. Do a practice run. You can cover it with a paper plate or a towel or a little paper towel, something so that they can gradually acclimate to the food instead of being like seeing it and panicking.
Yeah. I think that's what Dr. Cal does by putting his charts in front of my desk. He just gradually just puts his charts for me to sign. But yeah, so going back to that positive experience, I think yeah, I think that's something that many parents and they might not realize to do. But yeah, I think
Right,
putting a
right.
food that the goal food of the week or the month or whatever,
Mhm.
and just slowly kind of just place it around and let them discover, let it be on their terms. I think that's a great idea.
Yeah, so there's no pressure.
No pressure.
And then even putting, sometimes I even tell parents, is like, if you make a plate for somebody and say the child doesn't like peas, well, put stuff on the plate that they do like, that they'll be successful with, and then maybe put only 2 peas on the plate, because you have to think of it this way. Say you hate sardines. Well, if I give you a big pile of sardines on the plate, it's not going to be
overwhelming.
appetizing. It's overwhelming. So, but if you put a little piece, maybe you'll explore it or try it.
Another thing that I get a lot from parents is like, oh, my child won't eat, for example, peas, but I just hide it. I hide it in their foods. And to me, I feel like that's probably not the best way to do it, because you're tricking your child, and then your child's going to find it.
Right.
And then they're not going to trust you anymore with new
Correct.
foods. Is that something that you see also?
I agree. And granted, there are situations with children where, they are in a phase where they're not liking a vegetable, and you puree it up and blend it into something else, and they're fine. But overall, if a child is apprehensive, trust is huge with eating. So you don't want to fool them, because like if you hide the pea in there, and they will find it.
Oh, yes.
They will find that pea. They're not going to trust that you're not going to do that again.
Right.
Similar as if you were an adult and somebody put a little piece of fat in there and you found it and it was very aversive to you, you're not going to want to do that again.
Yeah. Or in our realm, when the parent would be like, oh no, there's no shots today. There's no vaccines.
Right.
There's no vaccines. And knowing that there's vaccines, and then we're like, yeah, they're right. It's like, well, you told me there.
Right.
It's
It
the same.
erodes all the trust.
Yeah. Just tell them from the get-go, listen, there's some peas in here, or maybe I mashed that up, but you won't, just give it a try. And if they say no, don't force it. Maybe try again a little later.
Right. And I think also, many times, you find foods that children like, so then you start to gravitate toward giving those foods because they'll eat them. But a thing that really we have to be cognizant of is that we don't want to give the same food every day, even if it's even if it's part of another plate, because slowly you're starting to encourage monotony. And I only want these 3 foods because I'm getting them every day, and they have to learn that eating is a variety of things. So you don't ever want to latch on to, oh, I know they'll eat the mac and cheese, so I'm going to give it to them for lunch for the next 4 days, because then it starts to narrow the spectrum of what they're willing to eat.
Yeah. No, I agree.
The other thing I think it's important to bring up is that a lot of times issues with feeding is you have to refocus. It's not the food, because children and toddlers, they don't want to be picky eaters. It's not like they want that. But oftentimes it's other things that impact their feeding. So around 2, I think a lot of times the reason why we get, oh, my child won't eat. Well, it's not that they don't want to eat the food. It's a control issue. I don't want to eat right now, and you're not going to make me eat right now because I'm 2 and I'm going to do what I want.
Yeah.
And I think a lot of times parents focus, they won't eat the chicken or they won't eat the green beans, but it's not about that.
Yeah.
It's about the control of, hey, I was expecting to have peanut butter and jelly, but I got green beans and turkey. But again, it's not that I don't like the turkey and the green beans. It's just not what I was expecting to eat. So there's that. And I think also the other thing too is there might be pushback just because, what you were saying earlier, Karen, I'm over hungry or I'm tired and I really don't want to eat right now.
Yeah.
And again, that's why I was saying earlier, it's okay to wrap it up and put it away and bring it out again later.
Yeah, it's how you present the question too. I've heard this many times where a parent will give kind of an open-ended question. It's like, oh, what would you like for lunch? And they'll be like, pizza. I'm like, well, no. I was like, well,
Right. You ask the question.
you asked the question. So I always tell parents, give them 2 options. Like, would you like a grilled cheese or would you like a peanut butter and jelly, for example? And then they can choose one of those 2 options that are, pre-chosen and are acceptable that you're actually going to make. But to give them an open-ended question like that, they'll be like pizza or mac and cheese. And then you're like, well, we're not going to have that. That automatically puts them in a kind of like a bummer mood where like, well, Now I don't like, it kind of brings them down a little bit.
Yeah.
Absolutely. And even with things like that, if, say, we're going to having peanut butter and jelly, you can make choices from there. Do you want it on the red plate or the blue plate? Do you want it cut in a triangle? Do you want it cut in a square? That way, when you're dealing with a situation where you're getting pushback from a toddler, then I think those are good strategies to try out to get them more engaged. That being said, if your child is not giving you the pushback, you could definitely just hear it is and present.
Right. But I think you really have to underscore the fact that a lot of times it's not about the actual food itself. It's more behavioral issues that you have to sort of, try to rise above.
And 2-year-olds are tricky. Like you're saying, they're very stubborn. For most of their lives at this point, they've gotten pretty much everything they wanted. They cry, they get held, they get fed, they get changed. For most of their lives at this point, if they needed something, there was somebody there tending to those needs, and then all of a sudden they're not getting their way, and they're like, well, this is new, this is different.
What do you think about, so, Johnny, you want to have that dessert. Well, listen, you have to finish what's on your plate here, and then you could have your dessert. Do you think that's an effective strategy to get them to eat?
So what I find is that when we look from before on things like self-regulating, what you're starting to do is you're taking away knowing when you're full and when you're not. You want a child to eat and enjoy the meal at hand and stop eating when they're full. And if you are telling them that you have to eat a designated quantity before you get a very high dense calorie dessert, then you're going to run into problems because now they've eaten until they're full so that they can eat again. So you're getting some difficult cues. Typically what I would suggest to the children that I work with would be to remove the dessert from the meal, have the dessert at a different time. So you're eating to eat and until you're done eating. And then a few hours later, or possibly even earlier in the day, that's when that dessert is served. But to insist that a child continue to eat, maybe after their hunger cues are telling them that they're done, so that they can enjoy something more to eat, tends to not lead to good lifelong eating habits.
And even the other issue too is that then the food, like the dinner that you're telling them that they have to eat, they're not eating it because they enjoy it. They're eating it because you're telling them to, and it becomes the chore, so to speak, to get to the dessert. So just because they're cleaning their plate of their green beans, it doesn't mean they're enjoying them and they'll eat them next time. They're just doing it as a chore to get to the dessert.
Yeah, and it's causing a bad association. They're going to associate green beans with a negative emotion, which is probably not what we want.
Yeah.
And it works the other way too. Like I always try to warn parents that reward behaviors with a treat. We don't want to associate a reward with food.
Yeah.
Because we don't want that association of, I eat food because I did something good.
Sure. What was your analogy, Karen? I remember you were telling me about the
behavior.
The spiders.
So basically, just to take a few steps back.
She's going to date herself now. Talking about.
No, I've changed that up.
Okay.
But basically, when you're looking at, say, a child is having a difficult time in eating something, our goal is for them to develop an interest and an ability to eat something so that they'll be more likely to eat it again. It might take time. They might have to try it on their own several times, but we want them to get more comfortable with a certain food. When we eat something just for a reward, we're not going to make that a lifelong eating habit. And the spider analogy, which I've probably referenced one too many times in other areas, is suppose that somebody offers you a spider, a live spider, and says, if you eat this, I will give you this car. You might eat that spider because you're getting that reward.
The Mercedes, right?
Yeah. Yes. So you might get that car, you might eat it because you got the reward. But the next time you see a spider, there is no way you're picking that up and eating it. You haven't, and so the point is you haven't developed an eating habit. You strictly did it for the reward and it stayed there.
Yeah, you didn't move the needle at all.
No.
So those are things you want to be cautious with, that if you say, eat this and you get this, it won't increase the likelihood that they eat that food again necessarily.
Yeah, that's a good point.
I think, and again, even if kids if they take the food in their hand and they miss it and put it on the plate or throw it on the floor, that's still considered an exposure.
Absolutely.
And it's still good.
Yeah.
You know,
Right.
it's not, don't count that as a negative behavior. Because
Yeah.
again, exposures to 10 to 15 times of being exposed to the food.
Right.
And it could be just looking at it, feeling it, cooking
Yeah,
with
and
it,
you can
talking about it.
encourage. Yeah, and you can encourage the kid. You know, you don't have to try it. You don't have to put it in your mouth, but smell it, mush it, draw with it, and you know, like you're saying, that exposure is so important.
Absolutely. Even just the way we phrase things. So if you say to your child, well, what did you eat? Versus, oh, how far did you get with that food? What did you think of the food? What were you able to do with that food? That can be very helpful because you are progressing towards them actually adding that food into their diet regularly.
That sounds more positive instead of like nagging and negative, where they're like, oh man, she's gonna ask me.
Right.
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 And with that, like if you may have made tremendous progress because you may have gone through not being able to tolerate it on your plate whatsoever to actually being able to put it in your mouth a little bit. So it's tremendous progress. But if the only thing that you're looking at is did you bite, chew, and swallow it, then that progress seems like nothing.
Yeah.
One of the reasons we brought an occupational therapist here today is because to teach myself and Alvaro something that we could take back to our patients in the exam room. You know, one of the most frustrating things I think around feeding for myself, and you could chime in if you see a lot of this too, is I'll get kids that are beyond a year of age and, you know, 15, 18 months approaching that too, and they will not eat textured foods and they're only eating puree foods, and you know they're just like not wanting to do it. And you know, oftentimes I send those patients to occupational therapy. Sometimes speech therapy does deal with that, so we'll give a shout out to the speech therapists out there too.
Absolutely.
But you know, where does that start? Or you know, was there something that happened along the way that those parents could have done sooner for those kids, and sort of what techniques or things should, you know, they be doing with these kids to sort of try to progress them along? Because you know, it's a difficult,
It is, and I do see
those
this.
kids are difficult.
Absolutely.
Absolutely, and you can see it from a young age, even as they progress into older ages. So a lot of things that we had talked about having a safe, comfortable family meal. The other things you want to do are making sure that everything is manageable for them. Are they sitting in a chair that they're well supported? Do they have utensils that they're able to use, like little forks and spoons? Are they finger fed? Things that they can actively do themselves. So making sure they can. And then also then looking at the pressures, you know, associating with it. You know, are you bearing down on them? Are you self-feeding them? Can you give them some space to self-regulate and eat the things? So those are some things. And then the other things you can do too is like gradually get them there through those other steps. So making sure that there are foods that are very easy for them to eat, and then progressing them from there. So going from a puree to something that's a little bit more easy to melt in their mouth, things like that, so they get more used to it. Other things is just making sure, when we look at texture, we look at it and from an occupational therapy realm, we look at sensory. So how is their body reacting to how things touch, taste, smell, feel, the movement associated, how are they feeling, how do things sound, how do things look. So making sure that they are completely in a good feeling, that they're calm and they're alert to being able to eat. So like we said, you know, if you take a child who is overtired and overhungry and then you try to have them eat, it's going to be very difficult. But if you say do something like before you eat, you do steps to prepare. Like for example, you might be out on the playground, you might be doing different things that would start to calm them, like marching or clapping and playing with bubbles and different textures and things like that, and gradually getting them to, okay, now we're going to wash our hands and we're going to sit down and we're going to work with this food, so that they're in the right frame of mind and their body feels good and ready, you know, for the challenges ahead.
So it all comes back to positive experience, having some patience, and letting the kid have some autonomy with their food and not be so oppressive.
Right. You know, even with older kids, you know, when you're with sweets and things like that, like I'm okay with a kid having a sweet every once in a while.
Absolutely.
Like I don't, you know,
Yeah.
I mean, you just don't want to become maladaptive. But, you know, for instance, say you have kids, you say you're gonna have you could have 3 meals and 2 snacks a day, you know, and you could have 1 sweet. You know, I think it's okay if you have the sweet available. It doesn't have to be hidden or coming out at a certain time. But, you know, say they take their cookie at lunchtime, and that's their sweet, and then, at dinner time, they go and they want it again. Well, you had your sweet for the day,
Right.
and if sister didn't have her sweet all day and she wants hers, then she could have hers at dinner, but that child's done with his. Now, if he starts sneaking food or something like that, then it's not really about the food. It's a trust issue at
Right.
that point, right? So you have to address other things. Again, it comes back to addressing those other things with the child, because it's not necessarily about the food if you can't trust them.
Right, and that's a very tricky situation. And I don't know if you have any insight on this, but I feel that in a situation like that, you would have to kind of pre-warn the child, like,
Yeah.
well, if you're gonna have your cookie at lunchtime, then just know that at dinner time you're not gonna have it, so that the expectation isn't like that they're aware at that time that this choice is
Yeah.
it's gonna prevent you from having a cookie.
That's
at dinner
consequences.
Time. Yeah.
Right.
But I think it's important to make them aware.
Yes.
So it's not like, well, I didn't know.
Right, it doesn't turn into a negative
Right.
because of that. And I think along that too, like when we're teaching the children about like quality of the foods and what these foods are they dry, are they crunchy, is it a protein? The children from a young age can say, okay, I need a protein, a vegetable, different things where they can start categorizing and understanding things. And then from there, sometimes too, just thinking outside the box a little bit as to when is the child hungry and what are they hungry for. So say, for example, if your family typically has cereal for breakfast and you're on the go, but your child seems very hungry and very willing first thing in the morning, it might be the time to bring in more of the protein and things like that. Likewise, within reason, you're going to present on the plate those foods that you're hoping your child would eat, giving them a little leeway in the order that they eat them. So not always saying, okay, well, you just ate this, so do not take a bite of that cookie now until you finish this. But as long as you've said that everything on the plate is something that you're able to consume, the order that they consume it, sometimes a little leeway goes a long way.
Yeah, and I'm a firm believer too that, going for that same example, well, you had your cookie at lunch, maybe don't eat it again for dinner, but ask them, like, why do you feel you need that cookie? Like, are you really truly hungry for it, or are you eating it because your sister's eating it?
Yeah.
Or because it's there? Like, because I feel like if you're truly hungry for that cookie and it's not because of any other reason, maybe have half a cookie. I think that's okay, as long as the reason behind it isn't because, oh, the cookie's there, so I want to eat it, or because my sister wants it. Well, if she has one, then I want one.
Right.
If it's a true thing that you really want to eat because you're really going to enjoy it, I think that's okay.
Yeah.
Right, and I agree, because I think you're looking at just understanding the quality of the food and how to enjoy it within moderation is, what we're trying to teach the child, so that when they're on their own, they don't eat a box of cookies for breakfast.
Right.
Yeah, of course. And then, those kids that really are just jagged on purees, what do you do as an OT where do you start the bridging? And what do you do with them initially? Like, do you let them chew on a celery stick, or how do you start it with the parents? You brush their tongue with a toothbrush, or to try to get
Right.
them interested in eating purees, because I need to know what to do with these kids.
And it's tough, and the age range is tough, and they're developing preferences. Certain foods, and it could be purees, it could be other things that they see that comfort in that food. It's predictable. They know what they're getting. Everything is the same in what they're getting. So what they're actually, they're liking that comfort. So we're also taking them out of their comfort zone with that. The one thing I would say is that you don't have to eliminate the puree. Don't say, okay, well, we're just throwing out the purees, because you're taking away a lot of comfort, and it might be a big jump for them. So having some puree some of the time would be okay. Some things that we would do as an occupational therapist is we'd look at what's going on in their mouth, making sure that their tongue and their teeth are ready to accept more complex foods. If a child doesn't eat more complex foods, they won't develop the skill, and then they won't be able to. So it becomes kind of a cycle that, so if the child is old enough and then they start, the skills will continue to progress. But if they don't, you're also going to have the problem that if you say, I'll give you whatever you want, eat this, they actually can't if it goes too far. So that whole concept of that reward concept, like, oh, no more purees, you need to eat this spaghetti, they've probably gotten into like a deconditioned phase where they can't. So what you want to look then is kind of starting to bridge that gap. So having them explore foods in their mouth. You can do things with toothbrushes, nooks. You can do things like blowing bubbles, blowing little cotton balls, things like that, getting their mouth moving. The little Gerber puffs are an excellent thing. If a child is motivated to do them, they're very easy. But that way you can practice with them, have them stick it on their tongue, have them move their tongue around, put them in the sides of their mouth so that they are then getting those mouth skills so that they're able to bite, chew, swallow what you're looking for. So you kind of would need to start to take them back through that progression again. And that's the reason why you do want to continue to introduce these foods, because if they're on purees too long, you just like if you're exercising and if you haven't run, in months, you can't run the marathon because you're deconditioned to do so.
Yeah.
So you want to be doing things like that, blowing bubbles, blowing whistles, moving little Gerber puffs around in your mouth, things like that, so that they become more able to eat
With their
things.
oral motor skills.
Right. And I would say with things like that could also then become basis for a referral. If you have a child that's over 18 months and is just not there, then you do get the concern of that decondition. So you would want to get more from a speech therapist, an occupational therapist, some very specific techniques to get it.
Yeah, I was just going to say, I'll leave that to the professional.
But the key is 18 months then, really, when, like, if parents are, like, that's really when you want to start saying, hey, this is just not going to go in the right direction. You need to get some help.
Right. I would say, as you're getting towards a year, you'd just be giving strategies. But once you get to that 18 months and you're not seeing that progression, you really need to kick in ideally with some additional intervention.
Yeah.
Well, I think we covered a lot. This might have been our longest podcast.
It might have
ever,
been, yeah.
But I think we covered a lot of information.
A lot of great information, absolutely.
Yeah.
It was a great episode. Thank you, Karen.
Oh, you're welcome.
Thanks,
Thank you for
Karen
having
Kyle,
me.
occupational therapist, for joining us today.
And remember, if you have a question about your child's eating habits or feeding or what foods to introduce, remember the information that we cover in this podcast is purely for informational purposes only. Right. I highly recommend you contact your pediatrician or your family, your primary care provider for specific information that relates to your specific child. That's very, very important. Don't just assume that everything's going to apply to every single child.
Mm-hmm. Exactly. Well, once again, thank you, Karen Kyle, occupational therapist.
Thank you for having me
today. Sure.
Yeah. And thank everybody out there watching us.
Yes.
Please, if you like the podcast, tell your friends. Remember to like and subscribe and leave a comment so that other people looking for quality information can find it. If you didn't like the podcast, tell your enemies and have them watch it too.
Right. There you go. All right. Well, this was Pediatrics for Parents, episode number 5. We hope you enjoyed it. We'd like to thank our sponsor, Co-Creative at Studio 16 South here in Wilkes-Barre, Pennsylvania, for sponsoring the podcast. We hope to see you all very, very soon. Thanks again.
Thank you, guys.
Thank you.
Thanks.